So the Trust has got a vision to deliver the best possible care to the people of Bradford, Airedale and Craven. We've developed a vision wheel that sits around that vision, and that vision wheel encapsulates what we're about, what we're focused on. So you and your care focuses on service users, their carers. That's surrounded by our 5 values. These underpin our behaviours as an organisation, as individuals working within the organisation. And then surrounding that, we've got 4 outcome areas. So we refer to these as the 4 quadrants, which set out how we're going to measure ourselves and how we know when we're delivering the best possible care.
The nurses strive to provide the best individualised experience for their clients that they possibly can do.
At the heart of what we do are the 6 C's of nursing, including care, compassion and commitment, and I think that outlines the philosophy of our team.
My approach to people is actually gaining the trust mainly. I think that's my main role, and doing the TLC bit, you know, getting people to feel at ease when they're coming to the dentist is a big thing. It's a scary environment, people aren't used to coming to the dentist, and dentists sort of invade your space, and so I have to get them sort of prepared for that.
Well, the only approach that I believe in is that everybody's an individual. So there's no way I can turn to somebody and say, oh, I know what you need, because I'm not them. So that's the main kind of direction I'm coming from. Is that, you know, no matter who you are, no matter what you've been through, you're still sorry and you deserve to be listened to be supported.
Because you can tell it's not from a textbook, it's from what he's been through and I've been through, exactly the same as what Nick's been through. And if it wasn't for Nick, I can carefully say I wouldn't be here now today.
Parents will have just one family nurse, and what we try and do is be a role model, somebody who's dependable, reliable, somebody who, you know, sort of is there for them whenever they need it, really.
If I didn't have a family nurse, I don't think I'd be the mum I am today.
I think the benefits of agile working we found is that we can be much more flexible, so we have much greater time with families.
You're given time, you're not just a number, so it's good to have a good nurse where you know any sort of problem you have, you can get seen by.
It's extremely important that we realise that when a patient comes into hospital, that it's a journey that they're going on, and food is part of that journey.
My favourite that I like is they've got Caribbean food, so I can have mutton or peppered steak and some rice and jam and plantain and stuff like that. It's really nice.
Part of my role is coming onto hospital wards, having meetings with service users, finding out what sort of things are working well for them in hospital, and also things that they can think need to be improved.
I've known Kim at least 30 years. And she's taken blood, and you can see how thin my little arms are. And she's only hurt me once. And she knows the names of all the service users by name. She greets them, man, by name.
The staff work really well together. Really cohesive team. Really interested in ensuring that patient care is kept up to an optimum level at all times, and that means communicating and caring for the relatives as well. It's ensuring that everybody's included in that person's care.
They're 100% caring, 100%, and I can't think of anything that I've seen happen here that I wouldn't be happy with if I was being treated here myself.
Since the introduction of continuing care model, all the consultants are based in the community, following their patients from inpatient to outpatient and vice versa.
We've opened some physical health clinics that concentrate on the physical health of patients with serious mental illness. We're reaching 1,000 health checks in a space of 4 months.
We've now trained over 1,700 members of staff in various care, stroke nursing homes, and out of that, and as a backup from the support and education and training sessions we've delivered, 89% of those homes have delivered a zero tolerance in pressure ulcers.
We're doing an awful lot of work with research studies, and even in my role doing biomechanics, we're doing all sorts of innovative things and trying to make things better for the patients.
They all work together. They care about you, they all talk to each other, so regardless of whether you see the same person, they'll always say, you know, how was Carl's foot last week, or let's try this, let's try that. And for me, you know, priceless, you know. I've only got one leg and they've managed to save it, so what's that worth?
I've always tried to do my best to deliver a high quality service, and I think you can never do that alone, and working together with people to achieve what we have achieved over the years that I've been health visiting is great job satisfaction.
She was often at the end of the phone when I had hundreds of questions for her every day, and we'd made numerous house visits that I don't think I'd have got through those first early weeks without her help and support.
At the heart of what Practice Health Champion is about is working together. It's about supporting a better relationship between a GP practice and its patients.
We are only volunteers, and yet we feel as if we're making a difference.
National average for people dying in the preferred place of death is around 24%, and within the fast track service we have patients dying at home 80% of the time. We would like to call ourselves a Rolls-Royce service because we individualise the package to meet that patient and family's needs.
I don't know how he does it, but he just gets everything done lovely. Everything lovely. You can trust him with your life. I can trust him. Well, I do trust him with my life.